Hey, good morning. Today we can study about the nephrolithiasis. Nephrolithiasis is the formulation of calculi. Calculi means stones in the kidney. Nephrolithiasis, that means formation of stones in the kidney. That how we can assess that if a patient comes in emergency department with abdominal pain or any flank pain, and how we can differentiate is that the patient is having nephrolithiasis or kidney stones. First is the patient may experience colicky flank pain. If the patient is telling the complaint in a colicky flank pain, at that time, flank always this flank pain is related, kidney related only. If it is a colicky flank pain, that means there is a stone in the kidney. And dysuria. Dysuria means painful urination. The urinary frequency and urgency. That means the patient has the urge to void, and he may go to bathroom in between, or in a patient has the tendency to void in between, and also patient may experience nausea and vomiting. These are the assessments of the nephrolithiasis. While we get case study in NGLEX questions, if they may ask like that only, the patient has brought into emergency department with flank colicky pain since since 2 days or since one day like that, and also he has dysuria and this urinary frequency and urgency, and also he complained nausea and vomiting like that. If we are getting any questions at that time, we have to uh, find out the diagnosis. So all these assessment findings, we have to rule out that the patient is suffering with nephrolithiasis, and we have to put the answer nephrolithiasis. They may give the assessment findings of other disease conditions also. For example, cystitis, and nephrolithiasis, and some other cholelithiasis like that. They will give the options, but we have to differentiate the correct assessment findings with this nephrolithiasis. And what are the management for the nephrolithiasis? It depends on the size of calculi, and because if it is a small calculi, we can hydrate, or and the stones can be eliminated through the urine. But if it is a large calculi or large stone, it cannot be expelled out through urine, and that in such cases we have to cauterize the calculi. The main interventions it include depends on the size of calculi. Then pain control. Already patient has colicky flank pain. We have to control the pain and also increase the fluid intake. While increasing the fluid intake, more urine can be produced and these stones can be eliminated through urine. The medicine mainly given for this nephrolithiasis is tamlocin. Tamlocin dilated the urinary tract because it promote the urination. Tamlocin is mainly giving in nephrolithiasis management, and it dilates the urinary tract. Also, we have to avoid caffeine while taking this tamlocin. In addition, in nephrolithiasis also we have to avoid caffeine, and we have to avoid tell the patient to do not strain the urine and keep calculate. That's very important, and we have to tell the patient strain urine. After urination, it had to be filtered, and the stone has to be kept, because to identify that which type of calculi, we have to keep the calculi. That is an important thing. Also, the main risk factors for this nephrolithiasis is first one, dehydration. If we are not taking adequate fluid intake, the the urine production is also become less. In such cases, the calculi size has the chance to increase, and will get the patient get the flank pain. And in case of gout also, gout means increase the uric acid production. In such cases also, There is the type of stones mainly include the uric acid stone, oxalate stone, like that only. But in case of gout, the uric acid stone production get increased. Also, if the patient has the previous history of calculi, there is a chance for nephrolithiasis, and it is nephrolithiasis mainly common in male patients. So these are the assessment findings of nephrolithiasis and the main interventions. This is very important. This is the one topic which get the higher chance to come for case study. Thank you.